Welcome to Medigap TV. Real answers about Medicare in plain English. If you spend your winters somewhere warm, this video is for you. Every year, I talk to Wisconsin Medicare enrollees who head to Florida or Arizona for the season, and they all ask the same question. Will my Medicare work down there? The honest answer is it depends entirely on which type of Medicare plan you have, and the difference is bigger than most people expect. I'm Lauren Marms, and I've been helping Wisconsin residents navigate Medicare for 17 years, so let's get into it. When it comes to coverage away from home, Wisconsin Snowbirds fall into one of two very different situations. If you have original Medicare with a Wisconsin supplement, you're in great shape, and I'll show you exactly why in a moment. If you're on Medicare Advantage, there are some things you really need to know before you pack the car, including one that could actually cost you your coverage entirely. Let's start with the good news. Original Medicare, meaning Parts A and B, has no network. That means it works with any doctor, hospital, or specialist that accepts Medicare anywhere in the country. You don't need a referral. You don't need to call anyone for pre-authorization. You just show your red, white, and blue Medicare card, and you're covered. Medicare pays its 80% whether you're in Appleton or Fort Lauderdale, and the same rules apply either way. And if you have a Wisconsin supplement on top of original Medicare, that coverage travels right along with you. The Wisconsin-based plan covers your co-insurance at any provider that accepts Medicare, and it works identically whether you're in Wisconsin or Arizona. Every rider you added to your policy applies wherever you use your Medicare. So there are no network calls, no pre-authorization headaches, and no surprise bills at checkout. It's genuinely one of the best things about the Medicare supplement structure. Here's a bonus for anyone who travels outside the country. Wisconsin's Foreign Travel Emergency Rider extends your coverage internationally. There's a $250 deductible per trip, and after that, the rider covers 80% of your emergency medical costs anywhere in the world, up to a $50,000 lifetime maximum. That covers most travel emergencies, and if you travel outside the U.S. regularly, it's worth asking whether you have this rider on your current policy. If you're finding this helpful, hit the like button and subscribe so you never miss a video. Now let's talk about Medicare Advantage, because the story here is very different. Advantage plans are built around a service area, which is typically a county or a region, and your coverage is tied to that area. If you have an HMO plan, you're covered for emergency and urgent care outside your service area, and that's it. Routine care, specialist visits, follow-up appointments, ongoing treatment for a chronic condition, none of that is covered when you're out of state. If you have a PPO plan, you have a little more flexibility, but out-of-network care comes with significantly higher cost sharing, so you're paying more every time you use it down south. Here's the warning I really need you to hear. Some Medicare Advantage plans have a policy that allows them to actually disenroll a member who spends more than 6 consecutive months outside of their service area. If you leave Wisconsin in November and come back in April, that's 5 months and you're probably fine. But if you push it to 6 months or beyond, some plans can use that as grounds to drop your coverage entirely. This is one of the most important things Wisconsin Snowbirds need to know, and most people have no idea it even exists until it's too late. And here's what makes this situation even more serious. If you're on Medicare Advantage and you decide you want to move to a Wisconsin supplement, it is not as simple as just signing up. Moving from Advantage to a supplement in Wisconsin requires health underwriting, which means the insurance company can review your health history and they can decline your application. Wisconsin does not have a birthday rule, which 16 other states have, and which would give you a guaranteed switch window each year. Here in Wisconsin, that protection doesn't exist. So the decision you make when you first enroll matters a great deal. One more practical thing to keep in mind. Your prescription drug coverage works at pharmacies in your plan's network, so it's worth checking before you head south. The easiest approach is to use a major national chain, because most are already in your Part A network regardless of what state you're in. Even better, switch to mail order before you go. A 90-day supply ships to any address you choose, and that completely removes the pharmacy question when you're wintering somewhere warm. So let's bring this together. If you're on original Medicare with a Wisconsin supplement, your coverage travels with you, and you have real freedom to get care anywhere in the country without network restrictions. If you're on Medicare Advantage, there are 3 questions worth asking yourself right now. Does my plan actually cover routine care when I'm out of state? Could I be disenrolled for spending too much time away from my service area? And if I wanted to switch to a supplement later, could I even qualify? Those answers are different for every plan and every person. And that's exactly the kind of thing we help sort out. If you spend your winters somewhere warm and you're not completely sure how your Medicare works when you're away from Wisconsin, that's worth a conversation. You can call or text us at 920-545-4884 and we'll walk through your specific situation together. Or if you would like to schedule a time, the link is in the description. Thank you, and we'll see you in the next video.